I'm Dr. Brad Knight. I'm the Director of Cardiac Electrophysiology at the Bloom Cardiovascular Institute at Northwestern Medicine. So today we're going to perform the first pulse field ablation procedure since commercial access in the state of Illinois. Pulse field ablation is the delivery of nearly non-thermal energy to cardiac tissue to cause ablation. And it is an alternative to the thermal sources that we've been using for many years. So we're very excited about this opportunity as an alternative to radiofrequency and cryoballoon for achieving pulmonary vein isolation in patients with atrial fibrillation. Pulse field ablation involves delivering very high voltage, very brief pulses to cause ablation of cardiac tissue. Pulse field ablation seems to be much more selective for cardiac tissue. So not only is it much faster and more efficient, the energy that's delivered seems to affect cardiac tissue more than other tissues, such as the esophagus, the phrenic nerve, and other tissues surrounding the heart. So its selectivity and its efficiency, I think, will offer huge advantages over the current thermal approaches. We were the only center in Illinois to participate in the Pulse Select trial sponsored by Medtronic, which led to FDA approval of this device. We were also the only center in Illinois to participate in the trials that led to FDA approval of Boston Scientific's FARAPulse catheter, the Advantage trial, and we continue to enroll in that trial. So both systems were recently FDA approved. The Pulse Select system was FDA approved first, and we now have access to that at Northwestern Medicine. We still get pre-procedural imaging in our patients prior to AF ablation, including with PFA. We'll use this to help guide our mapping for the procedure. I would envision that once we get some experience with this, we could probably do this procedure with even fewer catheters, just 2 catheters instead of 3, transeptal and an ICE catheter. So the current's going to be delivered through these pairs in a bipolar way of electrodes. And so it's deployed in a fashion we'll show you, but it's initially a spiral that turns into basically a circle with a small gap. So we have to make sure that when we go over a wire, we want to get good contact with the leading edge, kind of the electrodes that are leaning forward. And because there's a gap here, when we deliver PFA, we're going to deliver PFA and then rotate it and deliver PFA till we've felt good about covering the entire area. Probably in the last 10 or 15 years at Northwestern Medicine, we've moved almost exclusively for first-time AF ablation procedures when the goal is to achieve pulmonary vein isolation to use a cryoballoon. So the cryoballoon we have been using for several years. We've actually one of the first to use the second generation cryoballoon, the low-pressure cryoballoon that was commercially available a few months ago. It's very exciting to have access now to pulse field ablation. It has the potential to completely replace what we currently have been doing with thermal approaches with radiofrequency and cryo. And so we're very excited to have that. Pulse field ablation has the potential to be a real game changer for patients.